Wilson's disease, a rare inherited disorder that causes too much copper to accumulate in your liver, brain, and other vital organs. Copper plays a key role in the development of healthy nerves, bones, collagen, and the skin pigment melanin. Normally, copper is absorbed from your food and any excess is excreted through bile. It's an autosomal recessive genetic disorder. It is caused by the mutation in the Wilson disease protein, which is ATP7B. You might have a mutated ATP7B because a single abnormal copy of the gene is present in 1 in 100 people. This disease affects approximately 1 in 30,000 people worldwide, and the symptoms usually appear between the age of 12 and 23.
Symptoms of Wilson's disease include fatigue, lack of appetite, or abdominal pain. Jaundice is also a symptom, and it's the yellowing of the skin and the whites of the eye. They also have a tendency to bruise easily. There's fluid buildup in the legs or abdomen, and problems with speech, swallowing, or physical coordination are also involved. There's also uncontrolled movements or muscle stiffness.
Diagnosis. It's hard to diagnose because its signs and symptoms are often indistinguishable from those of other liver diseases, such as hepatitis. Your doctor may recommend blood tests to monitor your liver function and check the copper levels in your blood. Your doctor may also want to measure the amount of copper excreted in your urine during a 24-hour period. Using a microscope with a high-intensity light source, an ophthalmologist checks your eyes for golden brown discoloration, which are Kayser-Fletcher rings, or a type of cataract called sunflower cataract. In a procedure called a liver biopsy, your doctor inserts a thin needle through your skin and into your liver. Your doctor draws out a small sample of liver tissue and sends it to a laboratory for a test for excess copper. A blood test can identify the genetic mutations that cause Wilson's disease. Knowing the Wilson's disease mutation is in your family allows doctors to screen siblings and begin treatment before debilitating symptoms arise.
Wilson's disease will affect 5 systems. The first one will be digestive system. It's the main site of copper accumulation, and it is located in the liver. As liver cells try to make repairs to damage done by excess copper, scar tissue forms in the liver. The scar tissue makes it more difficult for the liver to function. Scar tissues limit the liver in its functioning because the scar tissue may cause the organ to stick to itself. The excess scar tissue then can lead to liver failure.
The second system affected is the nervous system. The second site that copper accumulates in is the brain. Cognition can be affected by Wilson's disease in 2 ways. One way is the frontal lobe disorder, which may present as impulsivity, impaired judgment, apathy, and executive dysfunction with poor planning and decision making. Secondly, Wilson's disease causes subcortical dementia, which may present as slow thinking, memory loss, without signs of aphasia, or agnosia. The copper is often seen most prominently in the basal ganglia, the area deep within the brain that coordinates movements. The face of the giant panda sign refers to a characteristic appearance of the basal ganglia in advanced Wilson's disease.
Due to liver disease/failure, there can be damage to the kidneys. The damage could lead to kidney stones and an abnormal number of amino acids excreted in the urine. This is called renal tubular acidosis. The most unique symptom of Wilson's disease is the Kayser-Fletcher rings. These rings are due to a buildup of copper in the eye. Wilson's disease is also associated with sunflower cataracts, exhibited by brown or green pigmentation of the anterior and posterior lens capsule. Neither cause significant visual loss. KF rings occur in approximately 66% of diagnosed causes, more often in those with neurological symptoms rather than with liver problems.
The fifth system affected by Wilson's disease is the endocrine system. Wilson's disease can lead to hypoparathyroidism, which is failure in the parathyroid glands leading to low calcium levels. The cause is essentially the destruction of parathyroid glands due to deposits of copper, but this is a very rare occurrence.
One of the treatments that people with Wilson's disease can take is penicillamine. It's a chelating agent that prompts the liver to release copper into the bloodstream. penicillamine can cause serious side effects, including skin problems, bone marrow suppression, and worsening of neurological symptoms.
The next treatment is Cyaprine. Cyaprine works much like penicillamine, but tends to cause fewer side effects. Still, there's a risk that neurological symptoms can worsen when taking Cyaprine, though it's thought to be a lower risk than penicillamine.
Third medication that will be prescribed to Wilson's disease patients is zinc acetate. This medication prevents your body from absorbing copper from the food you eat. Zinc acetate can cause a stomach upset.
A final treatment for Wilson's disease is surgery. A liver transplant may be necessary when the patient has severe liver damage. Finally, doctors might recommend putting copper in the patient's diet. Foods high in copper include liver, shellfish, mushrooms, nuts, and chocolate.
Thanks for watching.